Hi, my name is Nancy Palamara, and I'm the Director of Pharmacy and Infusion Services at Holy Name Medical Center. We're proud to be Sharsheret Healthcare Community Partners, and today we're going to be talking about biosimilars and how they compare to brand and generic drugs. The easiest way to do this comparison is to start by first talking about what a generic drug is. Essentially, they're copies of the original brand product. It's also important to understand that traditional drugs are typically made up of simple molecules that are easy to copy, while biologics, a newer drug technology, are made up of very protein complex molecules that are much harder to copy, and those drugs are called biosimilars. Now, the real question here is whether or not biosimilars or generic drugs are the same thing. So in order to explain this, I'm going to give you a few simple examples, and we're going to take a trip to the supermarket. So the first place we're going to go is down the condiment aisle where we need to buy some ketchup. And we're faced with shelves with 20 or 30 brands of ketchup. And when you're trying to make a decision on what to buy, what you know is that the main ingredient of ketchup is always going to be tomatoes. And from one manufacturer to another, the recipe may vary a little bit, but at the end of the day, you're going to bring home a bottle of ketchup. The next place we're going to visit is the produce aisle where we're going to buy potatoes. And so you have one potato in your hand, and you need to find 3 exact copies of that original potato. But we know you're not even going to find one exact copy of that potato, because where that potato was grown and the variations in the environment are going to change the shape, the size, and sometimes even the taste of the potato. But when you leave, you will have 4 potatoes that you can use in your recipe, and you're going to get the same results. So the important takeaway here from this examples is the ketchup is like the generic and the potato is like the biosimilar. But whether we're talking about brand, biosimilar, generic, if your treatment regimen includes a biosimilar, you can feel confident that you are going to have a drug that's as effective as the original, because the federal agencies have undergone the same review and approval process as they do with all other drugs. Now, you may be wondering whether or not your physician is the only person who weighs in on the decision as to whether or not a biosimilar is used in your treatment regimen. And while your physician is a very important factor in that decision-making process, there are other variables that take place. One is the hospital or the treatment center where you're seeking your care and whether or not they use biosimilars. The other could be your insurance carrier, who may also weigh in on this, because like generic drugs, biosimilars are also expected to be less expensive, and those cost savings can be passed along to you. And of course, you are an important part of the decision-making process. You have the right to know and to understand and ask questions about what medications are going to be used in your treatment and feel comfortable with what those decisions are. Now, you may also be wondering whether or not there's any risks associated with using a biosimilar medication in your treatment plan. The simple answer to that is no. So as we discussed earlier, these drugs will go through the same federal approval processes that show them to be as effective as the original, and those will also show them to be as safe as the original. Now, while there's no guarantees that any medication will produce the same results from one patient to another, please feel confident that these medications are expected to be as effective and as safe. At Holy Name Medical Center, we offer and use biosimilar medications, and we encourage you to ask members of your healthcare team, your physician, your nurses, your pharmacists, if you have any questions regarding biosimilars in your treatment regimen. Most important, understand that if you or your loved one has been recently diagnosed with cancer, we are all here for you. Whether it's through Sharsheret's amazing support services or Holy Name's expert and personalized care, we are with you. If you want more information, we encourage you to visit holyname.org/Sharsheret.